Good afternoon, everybody. Thank you for joining us today for our Phelan McDermid Foundation session. We have a great session for you, but before we do, we'd love for you to take a quick second and watch a message from our sponsor, Jaguar Therapy.
Mission at Jaguar is to accelerate breakthroughs in gene therapy for patients with severe genetic diseases.
With gene therapy, we can give the opportunity at a better life. That's what makes Jaguar special.
Now, I have the great honor of introducing my twin sister, Dana Winrow, who is going to talk to us about lymphedema. Hey, Dana, I know you're up in Massachusetts and I'm down here in our South Carolina, but feels like we're together. So thanks for joining us.
Thank you. I've had the privilege of presenting about lymphedema a couple times to the Phelan McDermid syndrome, but not for a very long time. So I'm hoping to update you on the information that I have and relate it to those with Phelan McDermid syndrome as much as possible. And I'm always available for questions and comments as I enjoy meeting everybody who has any concerns or questions along the way. So I'm just going to start by sharing my screen. So lymphedema and Phelan McDermid syndrome, the blue ribbon is the lymphedema ribbon that is sometimes used. My name is Dana Winrow. I'm a physical therapist, a certified lymphedema therapist, and have my accreditation from the Lymphedema Association of North America. So a little bit about me. I've been a physical therapist since 1997, and I took my lymphedema therapy training and have been actually practicing in lymphedema since 2003. I've practiced in many places, Pennsylvania, California, and now in Massachusetts. I got my Lymphedema Association of North America certification in 2006 and have kept it up since that time. I married my husband, Christopher, in 1997. And my son, Jonathan, was born with Phelan McDermid syndrome in 2003. My daughter, Tori, was born in 2005. And at home, we have 3 dogs, Took, Maple, and Hedrick. So we keep our house busy and full. So I'm going to try and go through the anatomy and physiology, about lymphedema, which does not change, and can pertain it as much as possible to Phelan McDermid syndrome and some of the questions I've encountered and some of the people that I've come across with Phelan McDermid syndrome and what their questions tend to be focusing on. So first of all, what is lymphedema? Lymphedema is a permanent condition that develops when fluid collects in the tissues and results in chronic swelling or edema. It most often occurs as a result of trauma to the lymphatic system from injury or surgery, but a poorly developed lymph or venous system can also result in lymphedema. So what that means is when you're swollen and it's related to the lymph fluid, then it is lymphedema. If you are born with some differences in your lymph system and it's not working efficiently, you can develop lymphedema, or if you have injuries, of which anybody can have at any time, you can develop lymphedema. So who gets lymphedema? People who have damage or improper function to their lymph system can get lymphedema, but not everyone does. You become at risk once you have damage to your system. So when you are born with deficiencies in your system, you can be at risk, and that's a large portion of the people that with lymphedema with Phelan McDermid syndrome. Or you can have damage like a lymph node removed, a bad trauma to an injury or to a limb, a surgery. Anything that can impair the lymphedema system later in life is secondary lymphedema. You're at risk of having lymphedema when your lymphedema system isn't working as efficiently, but you only start to swell or get lymphedema when your body is no longer removing all the fluid that it is transporting to that area. So Dr. Kate Still was able to provide me some information from the Phelan McDermid syndrome, International Registry. So from the information from the registry, not everyone answers the lymphedema questions, but for those that do, approximately 7.5% of the people in the registry have reported having lymphedema. 83% of them reported as being primary and 17% reported as being secondary. The average age at which it was diagnosed was 11. So two of the articles from the literature that have some information on Phelan McDermid syndrome and lymphedema specifically are provided below. One of them said that 7% of people with deletions, not just SHANK3 and neighboring regions, had lymphedema. The other article that had some information had a cohort of 201 patients, of which they found that 24% of those people had Phelan McDermid syndrome had diagnosed with lymphedema. 17% of them were diagnosed by age 5, and up to 71% were diagnosed into adulthood, 18 and older. So these are kind of interesting to show that there does appear to be some sort of link to genetics of Phelan McDermid syndrome and the presentation of lymphedema. So lymphedema is a fluid balance problem. So what that means is that we have normal, healthy circulation, bringing fluid into all of our tissues, and then returning it back through the lymphatic system to the heart, and eventually excreting the material. If the flow in is greater than the flow out, then you get a backup into the tissue of lymph fluid, and that is lymphedema and swelling. Lymphedema is caused by an abnormality of the lymph system. Stagnant fluid, the fluid that's sitting around not being removed, is mostly protein and cellular debris. Our lymph system is a transport system. The lymph fluid backs up into the tissue. The overall risk of lymphedema does not diminish. So we, at this point in time, don't fix the lymphatic system. We can't fix the vessels, and we can't fix the transport, and we can't fix lymph nodes. We just treat lymphedema by managing what is there and helping the system to become more efficient at managing the fluid. Progressive lymphedema was referred to as lymphedema that's not treated and that is worsening. And that usually happens when it is either left untreated or insufficiently treated. And that can cause tissue changes like hardening of the tissue, increased infections, and changes in the shape of the limb. So primary lymphedema, like I said, is when you have damage from birth. That means that something is wrong with the way that the lymphatic system has been formed, and it's not working the way we would like it to. So some of the things that they found in primary lymphedema are the vessels are too large. So we have little valves in there that help to push the fluid upwards and not let it go backwards. And if the vessels are really large, the valves won't touch each other, and so fluid slips past. The vessels are too small, so we're not able to pull enough fluid out to return back towards the heart. There's the wrong number of vessels, or the vessels are going to the wrong locations. So we're not really certain which of these could be happening in Phelan McDermid syndrome, but it's possible that our lymphatic system is a little bit different for those that have lymphedema than other people's lymphatic systems. Secondary lymphedema is when you have an obstruction or injury to the lymphatic system later in life. So, you fall and you have a deep cut on or fracture on your leg. Did you impair some lymphatic vessel along the way? Are you wearing something that's kind of obstructing your circulation a little bit? Things like that are related to development and not genetics. So the purpose of the lymphatic system is to remove proteins. So your healthy circulation brings and nourishes all your tissues. Your venous system actually removes most of the water and returns it back to the heart, but the lymphatic system is usually a little bit larger molecules like proteins and cellular debris, and returns it back as part of your normal healthy circulation. The second is to move fluid. So it moves about 10% of the fluid, and if the venous system isn't sufficiently removing fluid, it will help. And the third is to identify substances that do not belong and attach and destroy them, so helping in fighting infection. The lymphatic system is throughout your whole body. It circulates in the tissue's interstitial space. So it's not in a joint or a vessel. It's actually all intermixed with your healthy tissues. 90% is reabsorbed by blood and tissue cells, and 10% is left behind. The lymphatic system drains excess fluid and protein. It is a different transport system than the blood, but like a lot of things in our body, it helps out. So if the venous system isn't working quite as efficiently, sometimes the lymphatic system will kick in and help out a little bit more with returning fluid. And when the fluid is not draining, that's when you have lymphedema. So if your lymphatic system is inefficient, you may not know that until you develop lymphedema, until it becomes inefficient enough that there's fluid left in the tissue. So where does lymphedema occur? Our lymph system works in sections or quadrants. So the head and neck region, everywhere above your collarbones, in that head and neck region, there's all the lymph nodes in your neck drain mostly things above your collarbones. Your other quadrants go from your collarbone to your belly button. Your right side of your body, front and back of your arm and front and back of your chest will drain mostly to your armpit. And the same with the left side of the body will drain mostly to the left armpit. In the lower quadrants from the belly button down, the right side of the body, including the front and back of the leg and the groin and the back of your buttocks and everything will join mostly to the groin region on the right side, and the left side will join mostly to the left side. Now, having said that, there's lots of connections, but that's our normal way of clearing our body. And so often, even with primary lymphedema, you'll often see one section of the body affected or one section more than the other. So the right limb won't always look like the left limb, even if they both have lymphatic impairments. The stages of lymphedema, the latency stage is when we really don't see anything. The system's damaged. We may or may not know we have lymphedema, but it just, there's no signs of swelling anywhere. Stage 1 is called spontaneously reversible. That is the stage when you see people swell and then it just goes away. Everything looks normal. Stage 2 is spontaneously irreversible. It goes up and down, but it doesn't ever really completely go away. It looks a little bit different. And stage 3 is lymphostatic elephantiasis. So stage 3 is you're starting to get skin changes. It's a little thicker. You may even get a malformations that don't look typical for the shape of the limb. So the biggest question I get when I see parents and they come talk to me is, do I have lymphedema, or does my loved one have lymphedema? The early signs of and symptoms of lymphedema include swelling, which can come and go. Your skin feels and looks tight. Your clothing or jewelry might feel or look tight. You have numbness and tingling in the area. You have pain, achiness, or heaviness in the area. And this means it's time to be assessed by a medical professional. You may or may not have lymphedema. Those are some of the symptoms that you can have when you have lymphedema. So these are examples of lymphedema. These are people, I think almost everybody on here is a left limb lymphedema. In the first picture, you can see the left leg has a change in volume in it. Same with the left foot, this left leg. And both of these arms are showing some different pockets of fluid and lymphedema in them. I had the privilege of having lots of Phelan McDermid syndrome family members provide me with some pictures that they gave me permission to share on this presentation. And so I'll be able to share a couple examples with you as I go along. So this is example of a 29-year-old individual who's got puffiness in their ankle region, all the way into the top of their feet and into their toes. You can see a little bit of overhang at the ankles and not as much bony prominences at the feet. So this is a good example of lymphatic swelling in the legs. This person is a 35-year-old individual. They have well-controlled bilateral lower extremity lymphedema and with not getting any cellulitis, and they spontaneously had some facial swelling here. It's unclear whether it was ever fully diagnosed with lymphedema, but when we look at primary lymphedema and the fact that our lymphatic system doesn't work as well, it's possible that something stressed the lymphatic system in that portion of the body and that there was some swelling in that face that could be related to lymphedema. This is an example of an individual who does not have any swelling at the moment. They do not have a diagnosis of lymphedema. You can see they have nice tendons that you can see really, really easy. You can see bony prominences and indentations in the ankle, and you can see hair, which shows good circulation and good growth as well. This individual does get indentations and discolorations, sometimes wearing different braces, but at this point in time, there's no signs of lymphedema. So I think I have lymphedema now. What do I do? Discuss it with your physician and rule out any other medical causes of edema or contributing factors. Get a prescription for lymphedema evaluation and treatment, and get evaluated by a lymphedema therapist. There's starting to be evidence. They used to say that once you have lymphedema, there's nothing you can do. There's starting to be evidence that at certain stages, you can prevent it from progressing or maybe getting as bad as it would have gotten if you did nothing. So I'm going to go into this in more detail. I know that doesn't feel like a very satisfying list there. I'm going to talk about it a little bit more. So which medical professionals do you contact? In the lymphedema world, we take prescriptions from everybody that your insurance lets us, but also with an MD that will give us an order to say that the rest of your system is working okay. So whoever you feel comfortable with, if you are comfortable making sure that you do not have something else going on, and you do not need further testing, and they're willing to give you a prescription that says lymphedema evaluation and treatment, then they're the right person to go to. A good lymphedema therapist will be comfortable sending you back to a physician if they don't feel that they have enough information or if there's something that else has to be investigated. The Phelan McDermid Syndrome Foundation has clinical consensus guidelines that they're working on for physical impairments, will include lymphedema recommendations. So I have a little bit of a tilt towards North America, just based on my own personal experiences. When I go to conferences, I go to international conferences. So there is other information out there about lymphedema therapists located around the world. And if need be, I can help you investigate and see what would be appropriate in your area. I'm going to give this a little bit of a North American tilt. The Lymphedema Association of North America and also the National Lymphedema Network both recommend that you go to a lymphedema therapist that has 135 hours of training, and that gives them their CLT letters behind their name. It is also recommended that they have a medical licensure, so they understand anatomy and physiology before they go in for their lymphedema certification. So here's a huge list under here: physical therapists, physical therapy assistants, OT assistants, massage therapists, speech language pathologists, nurses, doctors, DOs, doctor, chiropractor, physician assistants, and athletic trainer. So it's important that they understand anatomy and physiology, and then they can go on and receive the training. So there are courses that are also offered to physicians and researchers on like it's kind of a lymphedema in a day kind of thing. And those are meant for people to be good partners with lymphedema therapists, but not necessarily execute the actual treatment. The 135 hours means you're going to do the hands-on treatment. A certified lymphedema therapist can also get their Lymphedema Association of North America accreditation. And if they get these credentials, it's a test after they've received their training, which involves a certain amount of hours of coursework. Not everybody does it because it's not required and it's an expense. So it doesn't mean that the therapist you go to isn't well-trained, just is another accreditation to tell you about their experience. So how do you find a lymphedema therapist? You can make sure that they have their CLT, and you can also check if they have a LANA. But in addition to those things, you want to make sure they're comfortable working with both primary lymphedema or the type of lymphedema that you have, and the age group of the person that you have, if they're pediatric or adult, and also what their experience is and if they're comfortable working with you. Everybody receives the same training, but some people go on to say just work with breast cancer patients or just work with a specific in a wound care center, which may or may not be fine, but if you're going to spend the time to go to them, you can ask them what they're comfortable working with and to be able to work with you. At the end is a resource page, and a lot of these, like LANA's website, NLN's website, all these you can look up, find a therapist, and they'll help you look through names in your region. So I will go on a little bit more about finding therapists in a moment, but how is lymphedema diagnosed? Medical tests can be done, but a lot of medical history, interviewing and observation and palpating, feeling the tissue, looking at you and looking at your tissue structure is used heavily with a little bit of medical testing as needed. So like soft tissue imaging, MRI, CAT scan, and ultrasound, they'll tell you that there's fluid there, but they wouldn't necessarily tell you why it's there or what it is. Lymph vessel imaging used to be done mostly in research. It's done a little bit more, but it's very uncomfortable and not always giving you extra information. Volume, like in the pictures you saw, you can see a volume difference in limbs, electric conductance, genetic testing. There's been a little bit of markers found on chromosome 5. I don't think we have anything specific to chromosome 22 at this time. Vascular imaging is looking at, they're looking at, like, do you have a blood clot? So they might do ultrasound, or they might see, is your arterial and venous circulation, also called an ABI for arterial circulation, is it sufficient enough to be providing you with good arterial circulation? X-rays, blood tests, bioimpedance is looking at how much protein is in the tissue. So all of these things can be done. They're not always all done. Sometimes they're helpful, sometimes they're not. And to go through a bunch of testing, you don't need all of this. If it's necessary, absolutely. But sometimes a lot of information can be done just through the lymphedema therapist based on your medical history. So it's important to realize, both for lymphedema treatment and to rule out lymphedema, what causes swelling. When I see somebody and I want to treat them for lymphedema, I want to make sure their circulation is going to tolerate it, and also what else might be affecting their edema and their circulation. So cardiac, renal and kidney, pulmonary and lungs, blood clots, infections, surgeries, injuries, venous and arterial circulations, and medications can all cause types of swelling. This is an individual, age 10. They did have a case of cellulitis infection. There you can see that there's probably an infection possibly related to something to do with the toenail in that area. And then there was also a wart on the ankle. Through multiple visits and conversations, they were able to finally get diagnosed with cellulitis infection that was treated. Now, people with lymphedema are more susceptible to cellulitis infections, but a cellulitis infection needs to be treated with course of antibiotics by the physician. So I'm going to give you a Boston example. That's where I'm living at this point in time, outside of Boston. Between a lymphedema management and treatment center and a lymphedema diagnostic center. So most of the time I tell people to get their lymphedema eval and treat prescription and head to a physical therapist or an occupational therapist. And the reason I say that, again, North American specific, is because of insurance often pays for an OT or a PT to do the treatment and bill your insurance. Lymphedema management and treatment providers are often affiliated with a lymphedema clinic, and they're often in hospitals related to the amount of materials that are needed, the amount of training that's needed. They just tend to be in bigger centers. It's not to say there can't be private ones, there are, but they often tend to be affiliated with centers. So the type of centers that can have lymphedema centers are cancer centers, vascular centers, wound care centers, rehabilitation centers, and any one of them could treat you if they have a comfortable lymphedema therapist. Don't be intimidated by what type of center they are. They don't always have a doctor affiliated with them. It just, sometimes they'll get referrals from all sorts of doctors, but they will have more experienced clinicians with treatments, and the therapists are the ones that know what to do for treatment. There's usually a good relationship between their medical team and the therapist, but the therapists are the ones that have touched the tissue, worked with the tissue, figured out what works and what doesn't work, and then reported back to the rest of the medical team. So that is a treatment center. In Boston, there's a lot less diagnostic centers. In Boston, we have the Boston Lymphatic Center, or the BIDMC, and it's made up of 4 components. It has a lymphatic medicine, lymphatic surgery, lymphatic therapy, and lymphatic imaging. Within their program, they also have a physician from Boston Children's Lymphatic Hospital and lymphedema program that's part of their team. So it's all age groups. As you can see, lymphatic therapy is one of the components of their diagnostic center. Out of all the people I see and treat, I maybe send 2 or 3 people a year to them. I will usually send them there if I think that they need some more information. Often I'll send them there before treatment, and sometimes I'll set them there even though I'm comfortable treating them, just to get some more information. So you do not need further diagnostics, but if you feel that there's something that you might get more from going to a diagnostic center, by all means, feel free to call them and see what else you can get out of it. How do you treat lymphedema? So we found out that you have lymphedema or you have lymphatic swelling. So the gold standard for treating lymphedema is to decrease the swelling, maximize the lymphatic circulation and drain the area that's congested, get rid of the skin hardening as much as possible, improve function of wherever the lymphedema is, and relieve discomfort and improve quality of life. So complete decongestive therapy, or CDT, is the gold standard for treatment across internationally at this point in time. You will, like I said, there's things like they're working on medications and surgeries, but the gold standard for treating lymphedema is complete CDT, complete decongestive therapy. So manual lymphatic drainage, massage is generally referred to as deep tissue, so they call it drainage and not massage. It's like a skin stretching and pressure and certain technique to direct the fluid towards the lymph nodes and help it to get from where it's congested to an area of drainage. There is multi-layer short stretch bandaging. So this is all these components are used in part or in whole, depending upon what the person needs. These bandages look like ACE bandages and cotton and gauze, but they're a little bit different. The brown bandages are actually made mostly of cotton, and they are not as elastic as an ACE bandage. And that's really important for function, because an elastic bandage tightens as you sit still. Over time, it needs to be removed very frequently. And these bandages, when they get worn out, they'll loosen and fall off. Lymphatic exercise, the more that you move the joints and the muscles, you're creating a pumping action and moving the fluid. And skincare, we're looking at the squality of the tissue, how dry it is, any openings, any rashes or infections, any athlete's foot, those kinds of things are all part of treatment. A lot of self-management. When you're not with the therapist, what do you do to help manage the fluid? Compression is important because the fluid wants to fill back in. You can go for a very good course of treatment with a therapist, and if you do not continue with something compressing the tissue, it will want to go back into the tissue. So I always describe it like a sponge that's full of water. If you put a cup or a plate on top of it, it's going to want to go the other direction. So by applying a little bit of pressure on the outside, it's going to want to drain towards the vessels. Self-management with a pneumatic compression device or a pump. Pumps are meant to mimic that MLD portion, that manual lymphatic drainage or massage portion. And again, everything can be discussed in detail, but for some people that's appropriate and some it's not. It's a helpful way of applying a hour massage to somebody to help them drain in the right direction. I'm going to get back to the bottom part in questions at the end, but this is an individual who is 10, and their pump is currently set at 40 millimeters of mercury. And what that means is, like, when you get your blood pressure taken, how much of a squeeze is it to push the fluid up towards the upper body? And this one's currently set at 40. So we'll talk about the settings of a pump and how we decide on that and when to change it or not in a few minutes. So the things that you can do to keep your limb and area that may or may not have lymphedema or lymphatic compromise, avoid trauma or injury. Try not to do a lot of needle sticks or blood draws in the area that might just give an area to introduce bacteria. Use lotion, do good skin and nail care. Don't cut cuticles where you could, again, annoy the skin. Use sunscreen and insect repellent. Be careful with razors that they're not causing irritation or openings. Wear gloves when doing activities that could cause skin injury. If you do have any scratches or punctures, try and clean them and use ointment. For leg lymphedema, if possible, try and use a podiatrist to cut the nails if they're not being easily managed. If there's any signs of athlete's foot or dry, flaky skin, and it's more than just applying lotion, try and get a medication. And any signs of infection need to be treated right away. A cellulitis infection can, within 24 hours, have you in the hospital on IVs if it's ignored, and keep the body part moving. So reduce your risks. Activity and moving are really important. Try not to do anything that's too limb constricting, like cutting off the circulation if it's super duper tight, and compression garments, if they're the appropriate ones and recommended for you, adding a little bit of pressure can help. Fitness and weight. It's important to be active and healthy as much as you can, and it's also important to move as much as you can. And if you are a little bit larger, you just have more tissue that the same lymph system is managing. So that can be a little bit complicated for the lymphatic system, gives it a little bit more stress. And also if you have extra tissue, sometimes when you have folds and they're pushing on something, the tissue itself is causing extra pressure to the skin or a little bit of a kink in the skin and tissue. Exercise, move the body part. You can passively move it for those people that will let you, or for those joints that aren't moving as well. You're basically creating a muscle pump or back and forth motion. So anything that's kind of giving you a rhythmic type motion is helpful. Swimming, walking, biking, rolling, crawling, carrying, anything that's not super heavy. It's not to negate you from doing anything else that you like to do, but these are just good for your lymphatic system. So there's a lot of research constantly being done. They're trying to diagnose lymphedema by a blood test. They're looking for genetic markers. They're trying out different medications. I think they may have one that they're working on in Australia at the moment. I will follow up on that. They're figuring out causes of lymphedema and Phelan McDermid syndrome. So anything that I find, I will always post and get back to you with, or our scientific team will if we find anything. The articles that I have referenced are the most information I have at this point in time in that area. So effective management is that you can take control and help your lymphatic system to work the best it possibly can, help control the lymph system as best as you can, to have less symptoms, less pain and discomfort, and control that swelling as much as possible. So remember that there's still swelling. It's not all lymphedema, and some of the things may look similar to lymphedema. Swelling and discoloration that a lot of us get, a lot of PMS children get as well, is not lymphedema. It is just something that we get related to circulation and other things, but it's not lymphedema by itself. We have cardiac and pulmonary considerations that we have to include. Some people wear compression. It does help if it's the right compression and it fits you properly and is helping, same way that even those of us on our feet all day can wear light compression. Muscle pump, our legs working and muscles pumping, again, is going to help all sorts of swelling, and it's not necessarily lymphedema that it's affecting. And tilt table, some people, different levels of mobility, will use the tilt table and get a rush of fluid. Again, that's not necessarily lymphedema. So I'm going to go into the questions, some of the questions that I've got recently, and see if there's any more that I can help answer as well. But how do we know the difference between lymphedema and fleshy hands and feet that are common for PMSers? So I frequently get that question, especially at conferences. A lot of people talk about their acute, especially younger children's chunky hands and feet, or chunky legs, or a little bit of almost like a puffy hand or a puffy top of the foot. And they say, is that lymphedema? I'm not going to give you a clear-cut answer, unfortunately. What I know is that they do have that appearance, and a lot of kids with PMS do have that appearance. When I'm looking for lymphedema, if somebody presents to me, and they're especially in that pediatric stage, is their swelling changing on a day-to-day basis? Is it coming up and down? Are there things that make it better and worse? From the diagnostics, I know that most kids are diagnosed with PMS a little bit later, around 11, 12, 13. And that could be because that's when we notice it, and that's when physicians choose to look for it. But what it's also telling me is that most of the younger individuals aren't having a big burst of fluid. So I'm not sure if their lymphatic system is impaired at that point in time. I do think that as they grow a little bit and move a little bit more, that their fluid gets better dispersed and moved. I guess that begs the question is, do you need treatment at that stage of the time? If you're not having complications of swelling, you don't need lymphedema treatment. However, anybody that presents to me with a diagnosis of lymphedema, or if I'm determining if they have lymphedema, I provide a ton of education. So I may teach manual lymphatic drainage to be done at home. I might suggest some mobility exercises that you can do, or like, crawling or moving the legs in certain ways. And I'll give the individual, that particular individual, things to look for to see if lymphedema is worsening. But I think the fleshy hands and feet might be something that is not swelling at that point in time, but maybe just the way that we're presenting at that point in time. I'm not sure if it's a one-to-one correlation with lymphedema. So that's not a great answer, except for that I don't think everybody that needs to be treated that has fleshy hands and feet needs to be treated at that stage. So hopefully I can keep following that and give you some more answers on that as I see clinically and through research. The next question is, what is most helpful accommodations to ask for on an IEP for children with lymphedema? So individually specific, but we know that they need muscle pumps, so we know they need to get up and walk around. We know that they don't want a lot of kinks. So maybe if they're sitting for long periods of time with their bend in their ankle, a bend in their knee, and a bend in their hip, they might need to be adjusted and move differently. Some individuals respond well to their legs being elevated, but I find that if they're able to actually move, that's even better than elevation. But sometimes they might need a positioning tool or device at school to help them prop their feet up or something. Some kids wouldn't hurt to do lotion application and maybe even start to treat that as part of their self-care. And very few individuals get pumped at school, but if it was necessary and helpful, that could also be written into an IEP. The next question is, my pump is set for 40 millimeters of mercury, but does not appear to be working as well as it did. So when we look at lymphatic circulation, the lymphatic vessels are mostly superficial. And as you go deeper and deeper, you're starting to compress different tissues, and you also go on to compress your in towards the venous circulation. So what that means is, if you're lying in bed and your legs are kicked out in front of you, for an adult, it takes about 18 to 20 millimeters of mercury to return the fluid back to the heart in a healthy individual. So when they take your blood pressure cuff with a sphygmometer and they're pumping it up, that's what I'm saying is how much does your blood pressure, does your blood use to pump the fluid back up? And it's about 18 to 20 in a healthy adult. When you're standing up, standing still and not moving, so you have no muscle pump going, and you're working against gravity, you need about 40 millimeters of mercury in a healthy individual. Pediatrics will require slightly less than that. And damaged lymphatic system, which means you have lymphedema, will have a little bit of variation to that. If we go super, super high and we keep turning it up to about 80 or 90, we're no longer working on the lymphatic system, then we're working on other tissue. So if we dial the pump up so it's really pushing hard, what we worry is that it's not damaging the tissue per se, but not working on the lymphatic vessels. So I always describe the lymphatic vessels like a hose. I'm trying to apply enough pressure that my hose doesn't bulge, but I don't want to kink off the hose. I just want to help push the fluid in up through the hose. So most of my pumps are set somewhere from 30 to or 20, depending on how young the individual is, with going no higher than 60, because I'm working on lymphatic circulation. So if they don't appear to be working as well, the question will be, what other pieces of the puzzle? It might still be doing a pretty good massage. Is it getting past where the pump ends and draining all the way into the lymph nodes? Is there compression you can wear as soon as you take the pump off to help maintain the pressure on the outside of the tissue? Different things like that. But you can change a pump, but you should probably have a therapist help you figure out if it needs to be changed or if it's still doing its job and just doing a great massage, but other things need to be looked at to help control the swelling. I will see if there are other questions that I can answer. I'm just going to go through my references and I'll see if there's any other questions that you guys have. Most of my presentation is through information through the National Lymphedema Network, the textbook of lymphology for physicians and lymphedema therapists, lymphedema management, and comprehensive guide for practitioners. Then I have a slide, which I will put back up, which has a ton of websites and references of all things that are going on. Some of you may have been highlighted to the Lymphedema Treatment Act. That is the constant lobbying of trying to get lymphedema services paid for, like compression garments and different things paid for that either insurance does or does not cover. And I want to thank everybody that provided me with photos, questions, and contributions. Dr. Still with the scientific information for my presentation. Megan O'Boyle is a parent advocate who provides me lots of experience. And then all the people involved in helping me prepare for the presentation today. Kathy Fiscus, Diane Linehan, and Denise Cardo. Any more questions?
Right. Thank you so much, Dana. Yeah. I'm actually looking at the Q&A right now, and Andrea has a question. Does temperature affect lymphedema, particularly heat?
Yes. A lot of individuals, for multiple reasons, a lot of individuals in general, people get puffier when they are hot. All of us do. Anything that will cause an influx of fluid to an area, we have more, those with lymphedema have a harder time getting rid of fluid. So heat can cause an influx to the area. We sometimes say swimming is a great, it actually is a great external pressure to help get rid of swelling. But if it's above 80 or 90 degrees Fahrenheit, then it starts to cause an influx of fluid just by being heated. And then that could sometimes make it harder to get rid of the fluid ultimately.
All right. I don't see any more questions in the Q&A. So if you guys do have questions after, thinking things through, or if you obviously have somebody in your life that potentially could have lymphedema, feel free to reach out to Dana. She is definitely accessible and definitely knows her stuff. Being her twin sister, I don't get to see what she does in her day-to-day. So I have to say, watching this presentation, I learned a lot. And those are some big words that you used, Dana. So anyways, Andrea, thank you so much. She says, well done and thank you. This is recorded and it will be posted. So we hope if you guys have any more questions, you'll reach out as you go. All right.
Yeah, thank you, everybody.
Greatly appreciate it. Thanks, Dana.
Thanks very much. Like I said, anytime, I'm always happy to answer any questions or help you do any research that I can.